even if you have been living a healthy lifestyle, sometimes these things happen. It could be a family risk factor. It could just be your body system responding, not responding well to the pregnancy hormone. These things happen. Beautiful people, welcome back to my YouTube channel. This is Succinct Jumi. As you all know, I am always very happy to share valuable content with you which you can learn from, that would also increase your wealth of knowledge. Okay, so in today's video I would be telling you about 3 conditions that is common in pregnancy and they could lead to complication. They could lead to emergencies in pregnancy. Okay, so these conditions, they actually happen, we see it as normal occurrences in pregnancy, but then they actually need medical attention. Okay, so when you experience this kind of conditions in pregnancy, do not just sweep it under the carpet. Okay, make sure you seek for due medical attention. All right, so number 1 on my list is obstetric cholestasis. It is also known as intrahepatic cholestasis. So what is this condition about? It affects the liver in a pregnant woman. Okay, so it is a process whereby there is slow flow of bile into the gut. All right, so in a pre-pregnant body, or in our human body without being pregnant, the bile flows from the liver into the gut to help in digestion of certain food, right? But in the case of intrahepatic cholestasis, the production of bile is slowed down, and even the flow of bile is being slowed down, so it's not able to function to flow into the gut, so it digests food as it should. And how does this start manifesting? It starts to appear as itching in your body, because there is now accumulation of bile in your liver. They are not able to flow to where they are needed, so you start to feel symptoms like itching on the palm and on the soles of the feet. Don't get me wrong, I know itching is a very common symptom in pregnancy, and if you would agree with me, sometimes this itching is caused by stretching of the muscles of the body. Take for instance the gravid uterus. As the tummy is getting bigger, there is a kind of stretch on the tummy. You start to see stretch mark, and sometimes you get the itching sensation and all, which could be quite normal because of increased level of some certain hormones in blood. They also manifest as itching. But in case of intrahepatic cholestasis, they manifest more as itching on the hand and on the feet, although they could manifest also in other parts of the body, but it is more common on the palms and on the feet. And also this kind of itching worsens at night. Okay, so you could be fine all through the day, and then you start feeling itchy at night. You're not able to sleep. That should actually send a signal to you that you could be suffering from intrahepatic cholestasis or obstetric cholestasis. So it might not be the regular kind of itching that every other woman experiences in pregnancy. Some other symptoms that is also common with obstetric cholestasis is dark urine, pale poo, jaundice, which is yellowish discoloration of the eye and of the skin, because it has to do with liver. So you need to seek medical attention regarding that. Okay, although following pregnancy, after delivery of the baby, this situation gets better. Okay, the condition gets better with or without medication. And it is important for me to let you know that this is not really curable in pregnancy, but it could be managed, and it could be managed with topical solutions such as aqueous cream, and also the use of antihistamines such as Preterm. This should be prescribed by a medical personnel, okay, especially when it has to do with medication. So like I said, this does not totally take the symptom away, but for the time being, when you're really feeling itching, it could provide a sort of relief for you. It could suit your condition for that period of time. Okay, I should also let you know that 1 in 140 women would usually manifest symptoms of obstetric cholestasis. So watch out. If you're experiencing something like I've described, make sure you speak to your doctor or your midwife. Okay?
As simple as obstetric cholestasis might sound, it may result in preterm birth and stillbirth.
Number 2 condition I will be talking about is gestational diabetes. We are all familiar with what diabetes is. It is just a problem with the body, either inability of the body to produce enough insulin, or some of the body immune system fighting against the insulin that the body is producing. We all know that insulin is that hormone which helps to regulate the blood sugar. So if there is a problem with production of insulin, or the cells fighting the insulin being produced by the body, then there's going to be a problem also with the regulation of blood sugar. So the only difference between the normal diabetes and the gestational diabetes is that this diabetes is first diagnosed in pregnancy. You do not have diabetes normally as a non-pregnant woman, but it is first diagnosed while you were pregnant. Okay, so when you register in the hospital for antenatal clinic and you're being asked questions about your family history, you want to know whether you've had parents who had a history of diabetes, or you are from a country where diabetes is prevalent. Okay, so all this history taking helps us to know if you are at risk of gestational diabetes or not. So if you are at risk, you will normally take a test of glucose before 24 weeks or at most 28 weeks. So that means if we are not able to get you in for a test before 24 weeks, definitely you should have a test before 28 weeks. But whether you are at risk of gestational diabetes or not, there is a fasting glucose test that you have to do as a pregnant woman at least once in pregnancy, just for us to be sure all is well with your blood sugar. So whether you are at risk or you are not at risk, if any of this test comes out positive, then you have to be mindful. You have to continually, put an eye on your blood sugars. We may need to provide you with a kind of device which you would monitor your blood sugar with, because with diabetes, you could experience problems ranging from hypos to hypers. What I mean by hypos and hyper is high blood sugar or low blood sugar. Okay, so this is one of the most common problem with diabetic patients. Sometimes the sugar level skyrockets, sometimes it's so low and you just need some glucose, some oral glucose to get going or to boost your blood sugar. Then another thing with gestational diabetes is the mom are at high risk of having large babies. Okay, because with diabetes, one of the signs that diabetic patients could suffer from is obesity or being overweight. Okay, so if as a non-pregnant, we tend to, advise on weight control for a diabetic patient, you can imagine for a baby in utero, they also tend to become bigger or larger than age. So which could affect the baby when it's time for delivery. You don't want the shoulders getting stocked. You don't want to start having cesarean section just because your baby is large for age. Okay, sometimes these things can be unavoidable, but then I'm just telling you this just to know what to expect with gestational diabetes. But then it really needs to be controlled. Okay, it is not something you can manage on your own. It is not something you can manage at home. You need a proper medical attention. So sometimes you might be prescribed a kind of medication such as metformin, or even which is oral, or even insulin, which is usually taken subcut. We have different or varying type of insulin. So if you're able to know this, if you go for this test and you know you are suffering from gestational diabetes, it's going to prepare you better. It's going to help you to be more equipped about the knowledge of your condition. So you know when to take insulin, you know when not to take it, you know the kind of food to eat per time, you know what you're expected to do in terms of weight control. Okay, and also your BMI is also at risk, because with gestational diabetes you could add weight more rapidly than expected. Okay, I know that sometimes for a twin pregnancy you tend to add weight more, but then another thing that could make you add weight more is gestational diabetes. Okay, especially when you're having a single baby. All right, if you are in a region or a country where the glucose test is not done randomly, or it's not a kind of test that you would usually take at a certain week or at a certain period during pregnancy, as a woman, you should request for it, okay? Once you are over 12 weeks, you should start thinking of having a fasting glucose test. It's called the GTT. We call it GTT here, okay? So you can have the glucose test. You could request for it. You could go to a private lab. That is if you are in a country where it is not offered to you, randomly, like in the UK. So you could request to have a fasting blood sugar or a random blood sugar, just to see if your blood sugar levels are fine, if they are within range. Bottom line of what I'm saying is, ensure you get your glucose test during pregnancy. Make sure you ask for it. Peradventure it's been omitted, ensure you have asked for it. You don't know what condition you're going to come up with in pregnancy, so better to be safe than sorry. That is how I deal, okay? The third condition on my list is it's like 2 in 1, okay, but it's similar. So we have the pregnancy induced hypertension, and we also have the preeclampsia, okay? For the sake of this video, I would be saying PIH. You've got PIH, which is not well managed. It could progress to preeclampsia, and if your preeclampsia is not well managed, it will definitely progress to eclampsia. So what is pregnancy-induced hypertension? It is a kind of hypertension that is first diagnosed during pregnancy. Note, during pregnancy. And it is diagnosed when a blood pressure reading has been taken at least twice within a space of 24 hours. It could be more than twice, but let's say at least twice, two different times, and it remains high. And this reading is gotten when you are over 20 weeks into pregnancy, okay? So that means if we check your reading maybe at 12 weeks and it's high, we might not say it is pregnancy induced. It could be the normal hypertension, or it could be the normal raised blood pressure reading, not really pregnancy induced. But it is pregnancy induced when it is over 20 weeks in pregnancy, okay? If it is being discovered on time, it can be well managed, because there are various medications that you could take as a pregnant woman, to control your blood pressure, okay? So now to preeclampsia. Preeclampsia, the only difference with preeclampsia and pregnancy-induced hypertension is that with preeclampsia, there is protein in your urine, okay? So in a normal situation, our kidney has a kind of unit that helps to filter so many things from the urine. It helps to filter sodium, all these elements, okay, minerals. It filters them, and then it leaves the larger molecule, the larger particles up above the mesh, okay? It does not allow them to pass through into the urine. So when you start getting protein is one of these large particles, okay? When protein starts getting sieved into your urine, then it tells us that there is a condition called preeclampsia. All right, the reason is not far-fetched. In pregnancy, we have so many muscles relaxing because of the hormone progesterone produced in pregnancy. It relaxes so many muscles of the body, and the kidney not being excluded. So this could be a cause whereby the kidney, the muscles of the kidney dilates, and then it allows protein to pass through the urine. And when protein that should be in the body are being passed in urine, it calls for concern, okay? So some of the signs of preeclampsia include severe headache, blurred vision, edema of the hands and foot or the ankles, okay? That is swelling of the hands and the foot. If not treated properly, it could lead to damage of the kidneys, okay? And from there, it could also lead to eclampsia. This could lead to contraction of all the muscles of the body, and it could cause lack of oxygen to the baby. So we now start to think of how we can prevent preeclampsia from progressing into eclampsia. So eclampsia is when the pregnant woman starts fitting, this seizure-like movement, when you start to fit, having seizures, from time to time. This is actually harmful for the baby, because this seizure contracts the muscles of the body, contracts the uterus, could even lead to death of the baby, okay? So you need to know whether you have these conditions or not. It is okay to, say, I'm healthy, I've been fine pre-pregnancy, I don't engage in smoking, I don't drink, I don't smoke, so I'm not going to have conditions like this. Guys, even if you have been living a healthy lifestyle, sometimes these things happen. It could be a family risk factor, it could just be your body system responding, not responding well to the pregnancy hormone. These things happen. You don't need to flog yourself too much. All you need to do is to get proper medical attention. Okay, if you have gotten value from this video, kindly give this video a thumbs up, leave your comments in the comment section, share this video, and subscribe to my channel. Thank you very much. Till we meet again next time. Bye.